Hi, this is Dr. Hot Stuff. I'm a surgeon. I was paged.
Yes, this is Dr. McDonald. I have a consult for you.
OMG, you look like Ronald McDonald. Whatever. Go on. I cannot wait to hear what amazing consult you decided to wake me up at 3 a.m. for this time.
I know that the last 3 consults I gave you tonight were for cellulitis, alcoholic pancreatitis, and skin bruise after fall from toilet seat, but this one is legit.
What is it? And why is your hair so freaking red? It's 3 a.m. I must be seeing things. Nobody actually looks like that.
So the patient has abdominal pain. They have been in the ER for 8 hours now.
Great.
The pain has gotten better. I fixed them with 10 milligrams of Dilaudid.
10 milligrams. Is this a sumo wrestler?
No, it is a little old lady.
Is she asystolic?
I don't know. I can't honestly say that I have laid eyes on her yet. Her heart rate was 130, but it is now 115 after all of that Dilaudid. Yammy.
She's pretty tachycardic, huh?
What does that mean?
It means high heart rate, you rogue.
Whatever. If I wanted to actually learn things, I wouldn't have gone into a specialty where I can consult anybody I want to, and they will do all my work for me. So I am consulting you because the patient's CAT scan was read as extensive pneumoperitoneum and free fluid, consistent with perforated viscous. I don't know what viscous means. But it was a CAT scan of the abdomen, so I thought that it might have to do something with surgery, right?
You're retarded.
Oh, so are you going to see this patient?
Yes. In fact, I would have wanted to see her 8 hours ago when she got to the ER so it would be easier for me to save her life.
Oh shit. I have to go soon.
Why is that?
People are getting tired in room 2, and I need to go and help with the chest compressions.
Who is in room 2?
It is the patient I am telling you about. Do you want me to hold off on chest compressions for a few minutes so you can repeat the CAT scan? I heard that's a useful technique.
I think you might be legally retarded. But I suspected that the moment that I saw your ridiculous fiery red hair. So, what was the patient's exam like before she went into asystole? I suspect that she had peritoneal signs for the past 8 hours while you sat on your ass and laughed about drunk people.
I don't know what her exam was like because I have not actually seen this patient. The nurse said that she had severe pain, so I gave her boatloads of Dilaudid. It seems like she started to feel better after that 10 milligrams of Dilaudid.
How did you get a license to practice medicine? I am ashamed to be of the same species as you.
Fuck. Well, it looks like they've stopped chest compressions now. Thought's a bad thing, right?
It means that you, a blazing retard, has killed yet another life that I could have saved. Go away. I hate you.
So are you coming to see this patient?
Look, bitch, I just told you that she is dead now. I think Gift of Life will even mock you for what you did to this poor old lady. Well, I appreciate you calling to wake me up for the 4th time tonight. I didn't really need that sleep anyways, you d-bag. At least this patient indeed had a surgical diagnosis. But if you had examined the patient or had any hint of a brain underneath your red fucking hair, you could have called me 8 hours ago before she went asystolic. Don't you know that peritoneal signs are a bad thing?
Oops.
That's what your mother said when she had you.
Look, all I know is that the patient said oui, so I said Dilaudid.
You're a human wasteland. Goodbye.
So I guess that means you're not coming to see my patient. Who should I consult next?
The forensic pathologist for this patient. And a psychiatrist for yourself. For the love of God. Would you please go swallow a knife?